During the pandemic, a lot of mothers discovered that their kids have parasites. Some of them noticed that their kids were scratching their anus while sleeping in the living room. And worst, they also noted parasites themselves during diarrhea of their patients. Parasitic infections are among the most common public health problems today. However, a lot of persons are not aware of the devastating effects of the parasites. This session is all about parasites. The topic assigned to me is raising awareness for parasitic infections. I am Dr. Annalyn Reyes. I prefer to be called Dr. Yan Reyes. The outline of my lecture is I will talk about the cases of the most common parasites in the Philippines, the pinworms, the roundworms, the hookworms, and the whipworms, the prevalent studies of parasites in the Philippines, where are we now, what have we done, where are we going, and what are the vaccines for parasites. We have here a 16-year-old male who was noted to have perianal pruritus while sleeping in the living room. The mother said that it's her first time to see his son scratching his anus. However, the son said that he has been scratching his anus even before the pandemic. The grandmother said that it could be parasites. However, the mother said that she can't imagine parasite for his son since they live in a clean, posh subdivision and the child is studying in an exclusive school. They have very, very good hygiene conditions. So she can't imagine where can the child possibly get the worm. To be very objective about this, Scotch tape swab was done. True enough, there was recovery of a D-shaped embryonated egg. During Scotch tape swab, sometimes we can see an adult worm, and it is best to collect the specimen in the morning, right after the patient awakens, before a stool is passed, and before taking a bath. It is very important that it has to be done before taking a bath because the gravid worms usually deposit in the perianal area at night. Enterobius vermicularis is so common in the Philippines. It has a prevalence of 29% in private schools and 55% in public schools. Females are more commonly affected than males. It has a global prevalence of 200 million, which is more than the population of the entire Philippines. The habitat is in the cecum, appendix, the colon, and the ileum. Its lifespan is 2 months. The male usually die after copulation or mating. And after that, the gravid female goes to the perianal area, and after delivering the eggs, the female also dies. So even if the mother and the father dies, the eggs hatch are 11,000 eggs per ovideposition. So it is so many. How is it transmitted? Usually, pinworms are transmitted through hand-to-mouth transmission from scratching the perianal region or from handling contaminated objects. So most of the time, if a child is scratching the anal area and will touch the doorknob, and then another sibling touch the doorknob without washing the hands and eats the apple immediately, so the embryonated eggs can be transferred from sibling to sibling. It can also be transferred from beddings because it can stay outside the body for 2 to 3 weeks. So it is transmitted also through inhalation of airborne eggs in dust. So like for example, if you flip the beddings in the morning and then the eggs are there, so it can be transmitted through inhalation. There is also reinfection in the anus. But the most common mode of transmission is hand-to-mouth transmission. In pinworms, retroinfection is also possible, wherein the eggs hatch in the perianal region and the larvae migrate back into the intestines. At the site of attachment, there is minute ulceration and abscesses, usually in the cecal mucosa. During the egg laying time, there is intense pruritus in the perianal region, resulting in scratching the area until it is scarified. Sometimes, due to severe itching, there will be hemorrhages or eczema, and sometimes there are superimposed bacterial infection in the perianal region. The migrating worm may also go beyond the perianal region. It can go to the vagina from the anus and can cause vulvovaginitis. It can go to the fallopian tube and cause salpingitis, and sometimes it can also cause appendicitis. The management is albendazole, 400 mg once a day, and the alternatives are mebendazole and pyrantel pamoate. All of these are available in the Philippines. For the prevention and control, all household members must be treated at the same time. So if one sibling is affected with pinworm, the mother, the father, the grandmother, even the helpers and the drivers should be treated. So it is a common problem in orphanages and institutions, wherein when you visit an orphanage, the nuns will tell you that these kids are scratching their anus. So it is very, very important to deworm all of them. So you can also prevent, especially with their personal hygiene. They have to shower and clean the anal area, especially at night, and change of underclothes. The fingernail should be cut so short so that the worms will not stay inside the fingernails. There should be hand washing after using the toilet or before meal. Bed linens and clothing of infected person should be sterilized by boiling. And don't shake the beddings when you fix them because it is transmitted through inhalation. We have another case of a 14-year-old male with productive cough, dyspnea, and wheezes. The initial impression was bronchial asthma and pneumonia, where an empirical treatment was given, affording no relief of symptoms. CT scan was eventually done, which revealed Ascaris lumbricoides in the left upper lobe and hilar region of the left lung. Peripheral blood smear revealed eosinophilia. The patient was successfully treated with mebendazole 100 mg 2 times a day for 3 days. Low floor syndrome is an allergic eosinophilic infiltration of the lung or allergic pneumonitis. It is a differential diagnosis when there is already empiric treatment for pneumonia or treatment for asthma was done, or even treatment of tuberculosis was done, and the patient still presents with cough, dyspnea, and there's eosinophilia in the blood smear. Low floor syndrome is now known as transient pulmonary infiltrates with eosinophilia syndrome. So as you can see here, it is caused by larval migration through pulmonary tissues. It is characterized by migrating pulmonary infiltrates with peripheral blood eosinophilia. The larval worm migrate in the circulation to the liver, to the heart, and to the lungs. In the lungs, the larva can break through the interstitial space of the alveoli and migrate to the trachea, where they are coughed up or they can be swallowed. Usually patients present with cough, dyspnea, pulmonary infiltrates, and blood eosinophilia. This is a boy who was noted to have a Ascaris worm from the mouth. Ascaris lumbricoides has a lifespan of 2 years, so it can live in the intestinal tract for 2 years, and they have 200,000 eggs per day. So that is so many. That's why they are capable of producing an army of Ascaris lumbricoides. So to diagnose, it is through direct fecal smear, and the Cato and Cato-Cats technique can also be done. The Cato is a qualitative technique, and the Cato-Cats a quantitative technique. So it is also best to compute for the egg per gram of feces. So in the right side, it is an example of getting an Ascaris lumbricoides in just 1 day in a rural village, in just 1 single day. So in the Philippines, it has a prevalence of more in females than in males. It is common in school-age children, 5 to 19 years old. And Owada et al., in his study, noted that there's a prevalence of Ascaris lumbricoides and Trichuris trichura co-infections in Luzon and Visayas. However, there is usual mono-infection, which is highest in Mindanao. The predicted prevalence of Ascaris lumbricoides is 10 to 20% across all regions. So in the Philippine epidemiology, Ascaris lumbricoides is common nationwide. It is in Luzon, Visayas, and Mindanao. So this is the table for the mono-infection with Ascaris and co-infection with Trichuris. So as you can see, there is more common co-infection in the Philippines. So that means Ascaris can cohabitate with Trichuris trichura. The management is albendazole, 400 milligram single dose, or alternatives are mebendazole and parenteral pamoate. Surgery can also be done if there is obstruction of the sphincter of Oddi and the biliary tree. So it is not only Ascaris that causes Loeffler syndrome, because hookworms can also cause Loeffler syndrome. So Loeffler syndrome in hookworm is also caused by larval migration through pulmonary tissue. Hookworms are characterized into two. The New World hookworm is called Necator americanus. In the right side here, it has cutting plates. And the Old World hookworm is called Ancylostoma duodenale, and they have teeth. The means of infection is skin penetration, and the infective stage is the filariform larva. They usually stay in the small intestine. So in the Philippines, the Necator americanus is more common than Ancylostoma duodenale. Hookworm is the most common parasite in the world. It has the global incidence of 450 million hookworm infection. So in the Philippines, they noted that it is greater in agricultural areas, especially when unprotected, because it is through skin penetration. It is noted in 1.1% in preschool and 1.9% in school-age children. Owada et al. Noted that the indigenous people of Davao del Norte has the highest incidence of hookworms. The lifespan of hookworms is 1 to 2 years. It can stay for 2 years in the intestinal tract, and the eggs hatch are so many. They range from 600 to 6,000 per day. So they are capable of giving 6,000 per day, and 6,000 new hookworms are on its way. Hookworms can also present as maculopapular lesions with localized erythema, edema, and papullovesicular lesions. I have already seen these cases, and it is also very, very common. It is secondary to penetration of the larva to the skin. Most of the time, there is continuous blood loss secondary to hookworms because they tenaciously attach themselves to the intestines. And there is microcytic hypochromic anemia, iron deficiency anemia, and hypoalbuminemia. So hookworms can produce a loss of 0.2 ml of blood per day. And if it is a chronic infection, they can live to 2 years and they reproduce a lot. It can cause iron deficiency anemia. Iron deficiency anemia can ultimately result to malnutrition, physical growth retardation, and cognitive and intellectual deficits. So it is very, very sad just to have cognitive and intellectual deficits due to hookworm infections or due to any other parasites. So to diagnose, we can do the direct fecal smear, or in the Philippines, direct microscopy is our diagnostic of choice. We can do cat-to-cats or cat-to-cats method, the Harari-Mori, and sometimes it can also be diagnosed through PCR or ELISA. We will now go to Trichuris trichura, or the whipworm, which is a flesh or pinkish colored slender worms. It is the #1 nematode in the Philippines so far. It is noted that In many parts of the world wherein protein energy malnutrition and anemia are common, the prevalence of trichuris trichuria may be as high as 95%. So in the Philippines, since we have an increased incidence of protein energy malnutrition and anemia, it's possible that the incidence and the prevalence of trichuris trichuria is 95%. So the lifespan of trichuris trichuria is also long. They can stay for 2 years. And every day, they're capable of hatching 5,000 to 20,000 eggs per day or 20,000 new worms per day. So aside from anemia, which is also caused by trichuris trichuria, severe infection may cause dysentery. There could be clubbing, abdominal tenderness, and sometimes they can also produce rectal prolapse. Diagnostic is direct microscopy, and you can see the barrel-shaped egg. The soil-transmitted helminths in the Philippines, according to rank, are number 1, Trichuris trichura, number 2, Ascaris lumbricoides, and number 3, hookworm infections. So it is very important to get the prevalence rate of parasites. So to compute for that, prevalence rate is the number of clients positive with the type of soil-transmitted helminthiasis infection among the total number of clients belonging to the age group. So in the Philippines, for preschool age children, the prevalence is 22.6%. For school age children, the prevalence is 28.7%. So why is it very important to know the prevalence of a soil-transmitted helminthiasis or STH in a country? WHO said that if the baseline prevalence of infection is 20% or more in children, there should be preventive chemotherapy, or there should be deworming, and in the Philippines, we call that mass drug administration or MDA. Biannual administration is recommended if there's a baseline prevalence of over 50%. Usually, the mass drug administration used is the albendazole or sometimes mebendazole. And the target are children 1 year old and above. So where are we now in terms of parasitism? So last 2017, the Integrated Helminth Control Program was formed for a vision of soil-transmitted helminth-free Philippines by 2022. So this was a 5 to 6 years planning and strategic planning. However, because we have a pandemic, the pandemic was not taken into consideration. So during that time, the plan was for all local health officers. They will take care of the preschool age children 1 to 4 years old and the out of school. And the Department of Health will take care of those 5 to 18 years old or the school age children, public and private schools. The plan was no child should be left behind. So the worming should be done to every child every January and July, because those in school are covered by the Department of Health and out of school and preschool are covered by the local health offices. So this is the Integrated Helminth Control Program plan that the Filipinos are among the healthiest people in Southeast Asia by 2022, and there should be soil-transmitted helminthiasis-free Philippines, or zero STH infection in the Philippines. However, the pandemic gets on its way, and it is very, very sad because this is not fully implemented. The plan then was to have a less than 1% prevalence of moderate to heavy intensity infection, and the outcome plan was more than 85% of clients should receive 2 doses of deworming drugs, and that is January and July. So this is the IHP strategic plan over the next 6 years. Then it was formulated last 2017 and it is now 2022 now, to reduce the STH prevalence of moderate and heavy intensity infection to less than 1%, The objective then was to guarantee a functional and responsive health delivery system for STH prevention and control of services. So it is not only the COVID cases that are affected, the pandemic also affected the parasitism cases in the Philippines. So what have we done? So this is a study which will be published by the PedsP journal forthcoming. So I am just allowed by the author, Dr. Fe Espino and Dr. David Tangkalagan, to share this prevalence report to you. This is a very, very extensive nationwide prevalence study of soil-transmitted helminths in school-age children in public schools in the Philippines, and they were able to objectively get 26,171 stool samples covering NCR and the whole provinces except Maguindanao and Sulu. In this study, they noted that 7,440 children were infected with at least one soil-transmitted helminths. So they computed for the light, moderate, and heavy infection through the geometric mean egg count, and this is a very, very objective study. So for Ascaris lumbricoides, heavy infestation is more than 50,000. For Trichuris trichura, heavy is more than 10,000, and for hookworm, heavy is more than 4,000. So their studies have shown that for Ascaris lumbricoides, there's heavy infection, so that means more than 50,000 in 3.2%. So these are the places. So it is very important for us to know all the places, because if we are living in these places, most of our kababayans may have those Ascaris lumbricoides, and we really have to help the government with it. So the provinces are Aklan, Marinduque, Surigao del Norte, and Romblon. How about hookworms? They noted moderate heavy intensity infection in the following places. So we also have to take note of this for hookworms. It is Zamboanga del Sur, Agusan del Sur, and Agusan del Norte, Surigao del Norte, and Bukidnon. How about Trichuris trichura? They noted light intensity infection. However, the prevalence is so high. It is 80.88%, usually in these places: Iloilo, Negros Oriental, Surigao del Norte, and Batangas. So it is very important for us also to take note of these places. So where are we going after knowing the objective evidence of this prevalence? So it is noted that every 5 years, frequency of prevalence should be done as recommended by WHO. So last 2018, they noted that the preschool age children has a 22.6% prevalence, and the school age children has 28.7% prevalence. So take note that the prevalence is still more than 20%. For the clinical and public health control of soil-transmitted helminthiasis, for an individual, the diagnostic criteria is parasitological. For the community level, the diagnostic criteria is just residence in an area with soil-transmitted helminthiasis with a prevalence of more than 20%. With that public health control, we already have to do mass deworming. So the treatment objective for an individual is parasitological cure, but the treatment objective for the public health control is to decrease the worm burden, and there should be reduction of transmission. To prevent parasitism, we have to improve education practice, and we should improve good sanitary condition and clean sewage facilities. The discontinuation of the practice of human feces as fertilizers, because a lot of places in the Philippines still use human feces as fertilizer. Do not walk barefoot in areas where parasites are common, even in seashores. And the most important is there should be individual and public health hygiene. Hookworm vaccines are already undergoing human trial. So in December 1, 2021, Lancet has this journal. The title was Vaccination of Human Participants with Attenuated Necator Americanus Hookworm Larva and Human Challenge in Australia, a dose-finding study and randomized placebo-controlled phase 1 trial. So in this study, it spanned from 2017 to 2018, and the participants were males 18 to 65 years old. And they were able to inject the hookworm vaccines through dermal application on day 1 and day 42. Their studies revealed that vaccination with UVC attenuated N americanus is well tolerated, induces humoral and cellular responses to hookworm antigens, and reduces larval output after challenge with unattenuated larvae. However, larger studies are required to confirm protective efficacy. In summary, we have already talked about the studies on the prevalence of Enterobius vermicularis and soil-transmitted helminths like Ascaris lumbricoides, Necator americanus, and Trichuris trichura, among others. We talk about its diagnostic, management, and prevention, and we also talked about hookworm vaccines undergoing phase 1 trial and the program for soil-transmitted helminthiasis-free Philippines. Thank you very much for listening. Parasitism is a common problem in the Philippines. We, as a doctors, have a role to play. Everything should start with awareness, then information dissemination, and then call to action. Let us cooperate with the deworming of the government, and let us also consider parasitism whenever patients present with cough, colds, and eosinophilia, and if they are not treated, if they cannot be treated with empiric treatment for pneumonia, bronchial asthma, or tuberculosis, so parasitism should also be considered. What is most important is we have to deworm our patients whenever indicated, and we have to help in the information dissemination to raise the awareness of parasitism in the Philippines. Let us hope to eliminate parasites in the Philippines and in the whole world. Thank you so much for listening.